one of the real strengths of the Hamlyn Centre and the ESPRIT programme is that close collaboration between the engineers and the clinicians on a day-to-day level. And I think it's making us produce the kind of work which is really high impact and really going to make a difference by bringing the technology into everyday clinical practice.
The sensor is a wearable device. It captures the movement of people. So when you wear it on the ear like this, and you walk, it can measure the movement. Hi. So today we have this EAR sensor here. The EAR stands for ear-worn activity recognition. And what this sensor contains is a 3-axis accelerometer, which communicates with the application that you can see running on this screen here. So we capture movement of the wearer.
So where this application is useful is really in rehabilitation and looking at prescribing exercise, just like you prescribe a tablet to a patient. Now often the patients after their surgery are followed up in a number of different ways, but they often say that they don't get enough feedback about their recovery process and how well they're doing, what things they should be allowed to do, can they get back onto the bike, go back to the gym or go back to work. What this allows them to do is in their own home use a technology which gives them an objective assessment of their performance. It really allows us to profile their recovery but also give them feedback on a day-to-day level to allow them to know what they should be doing, whether it's the right thing, and hopefully speed up their recovery.
This is the black box. It's a device that we use for rowing to monitor stroke rate and speed of rowers, and it's a replacement for very expensive equipment that usually costs thousands of pounds and takes hours to set up. The black box consists of a GPS module inside it, an accelerometer, and also an extension board where we can speak to other devices. We place this inside a rowing boat, and we can then monitor the stroke rate by looking at the accelerometer data and also the speed by looking at the GPS data. So it takes around a minute or less to set up, which is a great benefit compared to a propeller-based system. And I can just demonstrate a bit. You won't really see here, but as it moves forward and backwards, the stroke rate will increase and decrease. And the rowers use that to establish whether they should start rowing faster or slower. More so, the black box is a platform designed not only for rowing but for healthcare in general. So we also have an extension board where we can communicate with BSN sensors and ear sensors and any type of sensor. So this can be used as a healthcare home hub, where a black box or a healthcare home hub could be placed inside wards, clinical offices, or at homes, and people could just freely walk around with their sensors, and the sensors could upload the data to the black box and thereafter upload that data to the cloud. So as a companion tool to the black box, we also have some software to facilitate post-analysis of data collection through rowing. And what we can do is, after rowers have done their session, you can upload your data to the computer via USB cable and then look at the data and analyze whether players, or athletes rather, should have done anything different. The interesting thing is that with this data, you can also perform post-analysis on it using any algorithms that your team might usually use.
The BioMoving Plus is a motion capture system, so when you have these very tiny sensors and put these tiny sensors on your body segment, and then we can know exactly what you are doing and what your motion is. It can be used for the digital animation, robot applications, and also navigation, and most importantly, it can be used for patient, for healthcare, and also for rehabilitation.
BioPatch is a small platform which can be attached to your skin and can sense lactate or pH from your sweat. It can be used for athletes to monitor the lactate level in their sweat. Lactate level direct says how hard you work during training. BioPatch also can be used for monitoring of wound healing after surgery or after accident.
This is a wheelchair-based tracking system that we've developed here at the Hamlyn Centre of Robotic Surgery in Imperial College, and it's based on monitoring wheelchairs' movement throughout a game. We've used it with basketball players and also rugby wheelchair players, and the point of it is to monitor players throughout the game. Then after you know the players' positions throughout the game, you can come up with interesting algorithms to establish player tactics. The sensor itself only costs a number of dollars. When compared with other technology, you have to disassemble your wheel and put something in between. It's very expensive. So the reason why this is very good is because it's cheap and takes less time to put on.
ASIC is the technology we design for sensing the biosignals from human body.